Well, it's time now for our weekly check-in with the Lexington-Fayette County Health Department on COVID-19.
Yeah, we've got Kevin Hall with us on the phone. Kevin, thanks for joining us as always, and good morning.
Good morning. Glad to be here again, ready to talk COVID-19 and whatever else comes our way.
Yeah, first things first, let's go ahead and get the latest numbers as far as today. I know you guys just get those right about before you come on.
Sure. There's 71 new cases in Lexington through yesterday. That brings us up to 9,589 total cases. And sadly, there's a new death. Brings us up to 85 that's being reported throughout this pandemic here in Lexington.
And Kevin, yesterday the governor reporting the largest one-day increase in cases in the state, also calling it the third escalation. I want to get your take on this and sort of help us understand what that means and also how it compares to what you're seeing here in Fayette County.
Well, the good news here in Lexington is that we have reached a plateau, but it's a much higher plateau than what we saw earlier in the summer. We are not where we want to be or where we need to be in this outbreak. What we're seeing across the state, though, is this has been pretty common. When earlier in the summer, the cases across Kentucky were dipping down, and in Lexington they were growing, and now it's the reverse. And all that means is you have to treat every day and every location like COVID-19 is everywhere, because all it takes is one case from one person, and it can spread rapidly through businesses, residences, and then to the rest of the community.
How does the health department and how do we as citizens, I guess, kind of judge that? Because when we're looking at the numbers here in Fayette County and you're seeing consistently in between the 60s and 70s every day, below that 100 mark, we go, oh, great, that's awesome. How do we kind of dial that back and go, no, this is still going on?
You go to our website, lfchd.org, and we have multiple charts on there to give people all different types of data. You could look at what it's doing for age range, what the hospitalizations are, what the recovery information is, and to give you a truer picture, because it is not just the number of positive cases each day. There's more to it. One of the things you heard very early on was flattening the curve, because we wanted to keep the spread as low as possible to keep people out of the hospitals. That's one of the questions that always comes up, is how are the hospitals in Lexington? But Lexington is a hub for medical people throughout Kentucky. So it's not just going to be what's affecting Lexington. We are affected by the people in Powell County and Clark County and on through eastern Kentucky because they're coming here for services.
That's a good point. Kevin, I want to get your take on this too. We know early voting's underway here in Kentucky. Do you have any tips or maybe advice for people that are going in person to vote at these locations?
It's great that you say that. We were working on that literally, and I'm using it in the actual sense. I was working on it just before you called. You want to make sure you're doing the same things that you're doing no matter where you're going. Have your mask on to cover your face, to cover your mouth and your nose. You want to stay at least 6 feet apart from others. And this is one, bring some hand sanitizer with you, because as soon as you get done handling anything in the election area, you submit your ballot, use that hand sanitizer, and then go as quickly as you can to a bathroom so that you can wash your hands with soap and water for at least 20 seconds.
And as far as the flu shot goes, obviously still never too late to get that, correct?
Right. It is still early in the flu season. It typically starts in October and lasts until it can go into as late as May in Kentucky. It doesn't hit its peak until January or February. So go ahead, get that flu shot. They're free here at the health department by appointment. We have same-day appointments, 288-2444. Free, no hidden language there. Free, that's it.
Very good, Kevin. Any final thoughts today?
Again, keep doing what you're doing, in particular as we're going into Halloween. We're about to post on our Facebook page. We have them up on our website, lfchd.org, tips on how to stay safe, and then some other options you can do besides the typical Halloween parties that you might have with your family and friends. So check these out. They're from the CDC and the Kentucky Department for Public Health, and we're happy to amplify that message.
I do have one really quick, very important question. We've been talking about face masks. Yeah. Hormel has a bacon face mask.
It's
Kevin,
disgusting.
Is that something that smells like bacon? Would you want to wear that all the time?
I don't know that I could wear that all the time, because then I'd just be hungry all the time. But you know what? Whatever it takes to get people to wear that mask, go for it. So if it's a bacon-scented mask, great. Put it on. Do what you need to do to protect yourself.
Awesome.
Oh, Kevin.
Thanks, Kevin.
As
We
always.
appreciate it.
Thank you.
I think that was a resounding yes. I think he was
I
saying
think he
definitely
was
bacon
kind of
scented
undecided,
face masks.
You know, like be safe, but maybe not with bacon. Maybe.
Take it how you want it.
Still to come, because